Health Organization announced that the new strain of coronavirus is a variant of concern. The strain, now named Omicron, was reported to the agency by South Africa on Wednesday. The Omicron variant of the coronavirus has alarmed many scientists because of the sheer number of genetic mutations it carries, about 50 in all, including at least 26 that are unique to it. But more does not necessarily mean worse. World Health Organization began naming the variants after Greek letters to avoid public confusion and stigma. The World Health Organization, WHO, said on Monday the Omicron coronavirus variant carried a very high risk of infection surges. South African cases are likely to exceed 10,000 a day this week, up from barely 300 a day 2 weeks ago. Since then, it has been found in more than a dozen countries, including Botswana, the United Kingdom, Germany, Belgium, the Czech Republic, Israel, Australia, Canada, and Hong Kong. Omicron has prompted countries across the globe including the United States to limit travel from southern Africa, where the virus was first detected. The World Health Organization said on Monday that it carries a very high risk of infection surges, but said no deaths had yet been linked to the new variant. President Biden, last week, restricted travel from South Africa and 7 other countries over concerns of the heavily mutated Omicron variant of COVID-19, a move he said, gives the United States time. At least 46 countries and territories have imposed travel restrictions from several African countries following the discovery of the variant. Japan and Israel have banned all foreign nationals from entering their countries. Scientists do not yet know whether vaccines will continue to protect people from Omicron or not. The variant contains many mutations that suggest the shots may be less effective against Omicron than against other variants. Dozens of labs worldwide are now trying to assess exactly how much less effective the vaccines might be. They are not expected to have results for at least 2 weeks. The makers of the 2 most effective vaccines, Pfizer-BioNTech and Moderna, are preparing to reformulate their shots, if necessary. Some countries, including Britain, are preparing to expand booster programs to protect more people. PCR tests are an efficient tool for detecting the new variant because they do not require as long a wait for an outcome as genetic sequencing tests that require laboratory capacity not available in all countries. It's also too soon to tell whether Omicron causes more severe disease, although one doctor who treated some patients in South Africa told Reuters her patients had only mild symptoms. The most predominant clinical complaint is severe fatigue for 1 or 2 days, within the headache and the body aches and pain. Physical barriers also will work against any mutant virus. These include masks, hand washing, physical distancing and good ventilation. It is still too soon to make solid assessments of whether Omicron has a higher rate of transmission or will cause more hospitalizations or severe illness. Scientists are racing to understand the effect of the cluster of mutations seen in the Omicron variant. Still, comparing its mutations with those of other variants of concern identified by the World Health Organization suggests that Omicron can be expected to have enhanced transmissibility and some level of immune escape. We need to take all the necessary precautions till the time potency of this virus is confirmed.